At least you've seen the flyer somewhere to start from. Yeah, so the Health Economics and Policy Unit is in the School of Global Public, School of Global and Public Health, called SOCAP. It's set up as a joint institution between Ministry of Health and Co-Health primarily, and our major role is to inform, to prepare evidence to inform policy decisions, mostly through the Ministry of Health planning department. Although now we expanding it to replicate across the building blocks. If you know the WHO building blocks, yeah. So the health sector strategy, most strategies across WHO countries, most mirror their strategic frameworks are around the building blocks. Yeah. So the evidence entry window for us is health financing building block, but we're now expanding it to workforce, service delivery, pharmaceuticals, medical equipment, and digital innovation. So there's work that's already ongoing with a consultant recruited, and then a team that's going to set up that function. Yeah. So so just to underscore where we're coming from and our vision, at least in country. But also the same setup, at least what we're doing is being replicated in a few other countries. So just underscoring the importance of the initiative. Yeah. So from time to time, mostly we also, as part of learning, we always we were a learning institution. So we host people, visitors, and we are privileged to have Dr. Naren Prasad. So Dr. Prasad is the head of training and research department of the International Labour Organization in Geneva. It is the ILO's training program on evidence-based policymaking for decent work and social justice, and has trained policy makers around the globe. So I think so. We've collaborated with colleagues from the ILO, and I think they alerted us of your visit, and through that, yeah. So that's how we got to network. I think we see most the connection with ILO for us. I think something that has been on the back of our mind. We've been trying to set up the capacity for health workforce analysis, and with economics as an entry point, but more broadly, taking a multidisciplinary approach to policy. So yeah. We're keen to. Yeah, so we're keen to learn. We see this as a starting point for a collaboration. Even if you forget us, we will knock on your door again. Yeah, so I think as we're discussing outside, the labor economics is not a big area in health. I think there are I know of a few people in it, and also because they're not settled. We're not even where I know of. I think mostly it starts and then there's not many people to sustain it. We're hoping we can create something here and that becomes a national flagship, but also hopefully we can connect with ILO and WHO to then begin to create this space, because at least we believe it's an important space. Workforce in our context takes 50% of the resources, and so it's an area that we need to be concerned about how the efficiency of the organization, the distribution production system. So, yeah, so we eager to hear and learn from you, and more important, as indicated, to set this as a platform for further engagement. So yeah, welcome tomorrow. Just to Kuhes, I hope they've already welcomed you.
Yeah, sure.
Tomorrow, yeah. So to Kuhes. Our director, Professor Fusopengo, mostly yeah, he loves training, and is the one who really encouraged us. He's a proper teacher. Yeah, he's a proper teacher. So yeah, so I think he really values this. He's teaching the whole day today, and that would be the only reason you might not see him. Otherwise, he would have joined us online. So. Or maybe before you start, we can just quickly move around to see who is around. We invited students to join us, not just to fill up the room, but to ensure that at least one or two might get interested, and that would be a big impact. And then yeah, that's how we tap. Yeah, so maybe we start from this side.
Yeah, hi everyone. Yeah, so I'm Lucky Wheeler. I work within the HEPU policy.
So Tangwila is our health economics or research lead. In addition to leading the economic evaluation theme, yeah. Yeah, let's move. Don't worry. Don't get scared. Yeah.
Oscar Lucas, the students. Geneva, missing student.
Research fellow.
Gabriel Mbwana, research fellow in programming at HEPU.
Ahmed Bani, research fellow, learning center.
Yes.
Joseph January, health and professional education student and also neurosurgery clinical specialist.
Morris Woma, APPS.
Yeah. Okay.
I'm Chifundo and Bengo, MBA system.
Sita Zabera, PhD student in the lecture sciences.
Thanks.
Precious Tibet, associate research.
Good afternoon. My name is Joe Zonda, research fellow within HEPU.
Joe Zonda is a postdoc, but coming from general background in economics, so I think that's the one that we hope will.
He's the one that I'll tell.
Yeah. So for this work stream.
Emmanuel Mbui, nursing student year 3.
Okay, Energy, I work as the communications associate at HEPU.
I'm Richard Madi, a training coordinator with the Department of Research and Innovation at POES. So I'm basically in charge of organizing these seminars.
Beautiful.
So I think I'll have some 5 minutes at the end, but I'll introduce myself.
Sure.
Kampung again Lois, nursing student Kelly. My post was nursing student Kelly.
I'm Joanne Moina, corporate administrator.
What person research fellow HEPU?
Naren Prasad, lecturer who has and health professions education students.
Lovely.
We've worked in economics. Yeah. And I think the other thing is that although we are economics, but you need to understand that We are a more multidisciplinary research center. My director is an ethics professor. This is a programmer. There are a few programmers, and we've a social scientist, and we've medical doctors. So because policy is a multidisciplinary space. So I think everybody here, I think as he runs through, let's also take it from our disciplines and see how that relates to us, instead of being locked and think that this is good.
And how many are online?
We have four now, so I was still sharing the test for some on YouTube.
Can they introduce themselves? Okay, that's fine.
That's fine.
Yeah, thanks. So yeah, over to you.
Is a certain Ken shower there?
Not yet.
Yeah, over to you.
Right. All right. Thank you, Dominic. Normally, I write things at the beginning before I forget. Right. So I'll read a few things. Muli Bonji. Good afternoon. Thank you. It's really a pleasure to be here, an honor, in fact, to come and talk to you in Malawi here, speaking to these brilliant HEPU scholars, the nursing students, and those who are online. Really, it's a pleasure for me to be here. And I know HEPU is one of the, just listening to you, Dominic, just now, I think it's one of the leading institutions now, not only in Malawi, but also in the region. When I first got the invitation, I got excited, a little nervous, to let you know, because I'm not a health economist. So let's be clear, right? I'm not a health economist. I'm just a barefoot person like you guys, and I have walked like 8 kilometers every day to school when I was a child with no shoes, okay? My parents are not educated. They never went to school, like many here in Malawi. So I really identify myself with you guys, right? I come from an island called Fiji. You know Fiji Islands? You know, huh? Where is it? Huh? South Pacific, yeah. Pacific. Right. So I'm from there. I'm here because of certain policies that were right. So when I'll be talking about policies, it means it's personal, it's human, right? Policy, right? And secondly, when we talk about evidence, you're talking about evidence is something concrete, not abstract, right? So for me, being here, from that barefoot boy to come to Geneva and to be standing here, it's really a privilege to me, right? You as researchers, health economists, public thinkers, you are not on the sidelines, let me tell you that. You are on the front lines of social justice, what we call in our jargon. Social justice, that's what ILO works. I'll come back to those things after, once I have looked into my notes. I have spent 30 years of my career in international policy making with the United Nations, with UNESCO, with the UN Research Institute for Social Development, and ILO since 17 years, International Labour Organization. And I'll come back to that one, right? There's something I want to mention that recently I was reading an article that was published in the Foreign Policy. It's a magazine called Foreign Policy. And there's a guy a professor called Adam Tooze. He wrote that development is dead. The end of development, as we know. Because SDGs is dead. The Sustainable Development Goal is dead. Right? And he said what was missing from that was politics. You can have all the fantastic KPIs, the key performing indicators, the outcomes check this, check the box. But if you forget the politics, because policy making is politics, Right? Political Science 101, we learn policy making is politics. So when I hear researchers just talking to their numbers and KPIs, I get a little bit nervous. Because they forget the real world, what is happening. I know Dominic knows what he's talking about because he was in the policy making circles with the Ministry of Health. So this is the kind of person we need. And after, I've been training policymakers around the globe, telling them policy making development is all about politics, all about choices, make choices, right? So that's what I want to talk to you about today. Now, that was my written stuff, okay? Just to let you know. Now, I'll be talking more on the labor or health economics. No, labor economics, then on the health economics, okay? So you excuse me for that. As I said, I'm not a health economist, I'm a development economist, but working on labor issues. So that, you know who I am, you are listening, you'll be sitting there for an hour or so. Why would you listen to a guy from Fiji? So let me tell you a little bit about myself. So that, it's important. 2,000 years ago, a guy called Aristotle, who I've heard of him, he was a Greek philosopher. He said, if you want to persuade somebody, if you want to communicate with somebody, you have to have three things. One is your credibility, like you know what you're talking about, your credibility. Second is whatever you say, it should be logical, logos, right? And the other thing is that a little bit of pathos, which we call emotions. There should be some kind of emotions in how you communicate. Not you become emotional, but your message should be emotional, right? So in order for you to show that I am credible, here's my journey, okay? I was a little boy in Fiji. My parents never went to school. And I'm the first one educated in my family, like the generations. I grew up in a small farm, like in Malawi, but we have lots of coconut. We have cows and we used to cultivate rice and other stuff, right? And then something happened. From that small school, there's somebody decided that this guy, who is barefooted, went to school, could go to France and study mathematics. So I was given a scholarship when I was 17 years old to go into France and study mathematics. So I studied mathematics. And first I had to learn the French language. And then I did my undergraduate in mathematics and economics, social sciences, and a PhD in economics at the University in Paris. And if you want to see my publication, do Google Scholar, you'll find my publications on social policy, labor economics, on small island states that I've written a lot. And I've written a book or two. And then, while I was doing my PhD in Paris, I joined UNESCO. You know UNESCO, huh? United Nations Educational, Scientific, Cultural Organization, right? I was 26 years old. So I started my career then. From there, I went to Thailand with UNESCO in the regional office of Bangkok, dealing with education issues, curriculum reform, human rights, and other stuffs. Then I moved to one organization called the United Nations Research Institute for Social Development, UNRISD. It's based in Geneva. I was a research coordinator, coordinating many research on social policy in a developmental context, where social policies on education, health, social security, social protection should be used to transform the country. It should not be an add-on. It should be used to transform the countries, and that's what I was doing. And then I went to the United Nations in the Middle East, in Lebanon. I worked there for 2 years as the principal economist. And then I moved to ILO, the International Labour Organization, in Geneva since 2008. I've been working there. Right? And since 2010, I have been leading a program called, or a training program called Evidence-Based Policy Making for Decent Work and Social Justice. And that's why I was here in Malawi. I was here to train permanent secretaries of labor ministries, principal secretaries, director generals of the labor ministry who were here. 16 countries were in Malawi. ARLAC. ARLAC is the African Regional Labor Administration Center, which is based in Harare. So they organized the senior officials meeting here in Harare for the past 5 days. Today is the last day. So I trained them on how to use research and data to advance their policy work, right? I don't know whether I'm making sense or it's very abstract. What I talk about policy is real. Like how can you design a minimum wage for nurses, for example, which makes sense and it's evidence-based. You use research, you use data, you use best practices, and the knowledge from the local communities, how much money should be getting. For example, how can you provide social security to those people who are selling vegetables on the streets? Right? Real stuff. That's what I've been doing. But many other topics which is related to the labor economics. If you don't understand, I think you will stop me, okay? Because if not, I can go on and on and on. Right? So I'm in Malawi. Because of that, I came to train policymakers from 16 countries. Any questions so far? Because I forgot, in fact, I have brought some chocolates for you guys, no? It's not to bribe you, huh? So, I have some Geneva chocolates here, and I have some nice research, our ILO books, and I have some pens and other things you can take it from here, okay? This is my goodies bag, okay? So when you come here and take it, you have to ask me a question. If not, you can't take it, okay? Right?
How long was the flight?
That's a nice one, eh? That's a nice one, huh? I came from Geneva. This is for you guys, I don't mix it, eh? This is for the professors, huh? Yeah. There you go. I'm sorry for those who are online, okay? There you go. Huh? These are free for these guys, yeah? So anybody who wants to come and pick it up?
Yeah, I can start because I'm very hungry.
So you see, who asked me how long was the flight? the flight was, well, I came from Geneva to Addis, it's about 6 hours. So I had 4 hours waiting, and then 4 hours from, 3.5, 4 hours from Addis to Lilongwe. So it's like a whole day of traveling. But the good thing is, it's the same time from Geneva, it's the same time. So it's 12:30 in Geneva too. So there's no time difference. So you can take your chocolate and I take it. But I want substantive questions, okay? So how's the weather in Geneva? No, I'm not answering that anymore. Please go ahead.
Those who are not here, I'm Joseph January. I'm doing health and professional education with COHES, and also I am a general surgery clinical specialist. A rector at Naren Prasad Health Sciences. So I've heard what Dr. Naren was saying. Actually, sometimes we say we come from a humble background, but it's not humble. But most of us, we have come from a poor background, yeah? Because it can be humble but rich, right? Yeah. Actually, listening to your story is like most of Malawian stories. Yeah, we walk barefooted in lanes, and actually, it's encouraging that there are people from other countries who have done what we've been doing in Malawi. So I'm encouraged that I think across the globe we face the common challenges, and with what you've brought. And if we are to implement the labor economics and what he was stating, so many things can change in Malawi. Like the drugs, which they are trying to make sure that hospitals have drugs, and the policies are conducive for the nurses, the doctors. That is very good. Actually, we are receiving peanuts. Actually, our salary is less than $150 for 30 days. So it's very pathetic. Policies have to be made, and we need to be paid handsomely. We work tirelessly as doctors and nurses here, but they say our reward is in heaven. So we want the reward on earth. Yeah, we need the reward.
Thank you. Please feel free, right? Thank you for inspiring everybody. Yes, yeah, let me ahead.
Yeah, I think I missed from mathematics you went straight to PhD in economics.
Yeah.
So how has been the journey? Because myself, I'm also eyeing health economics as my major in the future. I'm also doing a health economics research currently as a student. Yeah, so I want to understand how has been the journey, because there is a lot of fears out there. It's health economics is something different.
Yes, very good. Thanks for your question. Yeah. No, my undergraduate was on applied mathematics, and in fact, I never wanted to study mathematics. In fact, there's a funny story. I'll tell you so that you understand. In Fiji, I was supposed to study economics. The Fijian government had given me a scholarship to study. So one of my friends did not have any scholarship. So he said, the friends are giving scholarships, so let's go and withdraw the form to fill. So I went with him. I said, well, I'm okay, I have a scholarship, I'm not going anywhere. So he was filling the form on the counter at the French embassy. He looks at me and says, you don't know how to fill? I said, no, I'm good, I'm okay. So fill it. Because the French officers gave 2 forms, right? So I scribbled it down. I just said, what subject I hate the most? There was a thing like, which subject you want to study, right? I said, which one I hate the most? Mathematics. I wrote mathematics. And in fact, I had all A+, but I didn't like it at all. I was given a scholarship in mathematics to study. That's how it happened. So I studied maths. I was okay, but never interested. My inside me was more economic, social sciences, understanding people, and then from my undergraduate in applied mathematics, I moved to applied social sciences. So I did a master's in applied social sciences using my mathematical knowledge in statistics, probability, calculus, and we wanted to, modelize the society. That's what I was doing. That was my master's in France, and from there, I moved to international development and a PhD in economics. So we use maths. It's very, very easy. Once you have that knowledge on mathematics, you can do anything with that. And that I realized later on, right? So that was my trajectory from maths to economics, but more development. And since I'm working with ILO, a lot of labor economics. In fact, if you are interested in the health economics, I have a colleague who's from Malawi, who works in Thailand now. He's our regional economist. I'm not sure if Ken is connected or not. He has 2 PhDs, right? and 2 masters, and he's doing the 3rd master's now on international trade and transportation. Right? So his first PhD was in economics. Second one he just finished last year in health economics in Lancaster University. So I'll put you in touch with him, he will guide you. He's fantastic. Is Ken connected or no? Ken Chow? No.
He should now, because he asked for...
Because I told him to connect.
No, he asked for the link about fundraising.
Okay.
So it should be now.
Okay, so you should get in touch with him, I'll put you in touch with him, okay? He will guide you, not me. You can take the chocolate, yeah.
Yeah. Despite that he was given an opportunity of scholarship, what have made you to be interested in policymaking?
Policymaking, yeah, that's true. Yeah, it's a good question. What made me get interested in policymaking? I started at the lowest level of our international career in UNESCO. I did a lot of education reform, curriculum development, talking to ministries of education when I was 26 years old. It was public policy, right? It was public policy. And once you talk to government people, you get interested in, people. And I was comparing my situation. And then I did a lot of research. For about 15 years, I was a researcher. I'm still a researcher. Once you are a researcher, you are always a researcher. I still publish papers, right? So research, but then when you do research, the problem with researchers is that our research stays on the shelves. We are not able to connect it to the policymakers that will have an impact. So I thought, I'm working with the research department of ILO. We produce fantastic reports, great research on labor market issues, on gender equality. You were talking about not getting enough pay, right? Like salary. We do research on that. How to calculate wages. Many things. So I said we have this beautiful research and evidence, but the governments are not using it. How can we do that? So the connect, that's where I saw the connect is we should transform the research findings to policy making. If not, it's useless. You can keep on doing research and publishing great papers, great journals, but if it's not having any impact, not great. For me, so when I go train people, I was here in Malawi. When you talk to the permanent secretaries and labor commissioners, you show them. I'll show you what I'm teaching. I'll show you shortly. When you see them and they understood the thing, and you see the sparkling eyes, you got it, right? That something will change in their countries, and that's how I measure that you have an impact, right? Your PS Chikondono was there. Yes, she was there. Yeah. And the chief minister, who was just sworn in, he came to do the opening. Justin, yeah, he was there. Justin Sadia. He was with us yesterday. Yeah, somebody was there. Yeah. Oh, now everybody wants the chocolate, huh? That's why they're asking the question.
Right. I didn't get it when details that.
Oh no, I'm not working on Malawi. I just came for 5 days. Tomorrow I'm going. I'm based in Switzerland, in Geneva.
I thought you worked.
No, but it's like my country. Same country. So I'm home.
Can I get one?
Please. Yeah, I think go ahead. Yeah, I want to know who sent us first.
Okay.
Yeah.
You said that you study in plants and you are not interested in user access waste. So how did you make it just the thing that you did when you were graduating?
I was not interested, but I was a good student. I was not interested to have a career in mathematics. Like, I don't want to be a mathematics teacher, right? But I used to understand things easily. But no more now. It takes me a lot of time to understand now. When I was young, it was okay. My brain was better. So that's why I was not a bad student. Yeah?
How do you know that your research you have done is implemented in the government?
It's a good question. How is your research is implemented? Well, there's no secret. If you publish a research and you leave it there, nobody will read it unless you go and talk about your research. So the communication part is extremely important. So you only know your research is useful when you go talk to the government people about it. And I'll take one example. In 2008, I contributed to, I edited a book called Social Policy and Privatization. Why water should not be privatized. The running water should not be in the hands of the private sector. And that book was used by the United Nations Human Rights Council as a reference to say water should not go into the hands of private sector, water is a human right in 2010. So you know that your work has been used to make better policies. It's one example. But I'm sure Dominic and Lucky have other examples to mention. All right, shall we continue a little bit? Yeah, and then you ask me more substantive question, okay? Right? Yeah. All right. So let me tell you something about where I work so that you understand. It's the International Labour Organization. That's where I work in Geneva. And this organization was created over 100 years ago, in 1919, right? And so far we have 187 member countries. Malawi is a member of the ILO. We have many field offices, I think 40, 41, and we work on the world of work issues like child labor, minimum wages, trade union rights, social protection or social security, working time, conditions of work, occupational safety and health issues, or sectoral based like public sector works, maritime workers, the rights, collective bargaining, the trade union rights. What do we do? Youth employment, how to create better youth employment. Now we are talking about green jobs, AI, the impact of AI on the jobs, gender pay gap, all sorts of issues we are working on. Anything that touches you as a human being when you are working, ILO works on that issue. So we work on all those issues. Right? So ILO also is what we call a standard setting organization. We adopt international conventions. So we have, how many? We have 191 conventions now. You can go to the website of ILO, www.ilo.org, you'll find many things, right? So just to tell you where I'm working, and I'm heading the training and education part of the research department. That's where I work, right? If you have any questions about ILO, I will tell you after, right? Now, I just wanted to mention, when we talk about labor economics, right? When you talk about labor economics, there are three main characters. It's a storytelling thing, right? Labor economics is stories, right? It's not only statistics and numbers. In the labor economics, there are conflicts, there are characters, there are plots, there's conflict resolutions, but then because of all these things, there should be some ground rules. And I'll tell you who sets the ground rules, right? So what I want to mention is, for example, when you were talking about we are not getting enough salary, wages, you want more, but the government is not giving you enough. So you have competing interests, conflicts, right? For example, if you work with the private sector wants to give you the lowest possible, and the workers want the highest. Maximize you should get the highest amount of money. It's normal, right? So there are lots of conflict. You have to resolve those conflicts, right? So that's labor economics. So the government, in fact, sets the rules of the game. So suppose a worker wants this guy. I want salary, I don't know, like from $150, I want $2,000 a month, right? And I need a big office with the 5 windows on the best floor. And you should pay for my transport. And then if I become sick, you take care of me. And I should have 50 days of sick leave pay a year, right? If something happens to me, you should protect my family, my children, right? You want the maximum. And your employer says, wait a minute, no. I will give you the, not 50 days, but I'll give you 15 days of leave, right? And if you want 5 windows, well, I'll give you 1 window, right? So you see the difference, right? So then the government comes and says, wait a minute, guys, we need some rules. It says all workers should at least have safe working conditions. Like you don't go to your workplace and be sick. It's polluted, it's hot, whatever it is, right? So they put the conditions. Or for example, saying that, okay, no worker in the country should be paid below $100 a month. Suppose they put the rule, right? Nobody should be paid below $100 a month. So there is no exploitation. So the government comes with the regulations and rules that shape the outcomes of the labor market, right? So this is all about labor market. So in fact, labor market or labor economics brings all these dynamics to life. Okay? It's not, as I said, not only through statistics and data, which of course shows, but through all this drama and decision-making process. This is labor economics. And health economics is a similar story, right? Right. So basically the deals between the workers and the firms about the kind of jobs, about what skills are needed. For example, in the nursing, right? What kind of skills do you need? That's something that has to be negotiated. I was talking to Dominic about this workforce planning. How many doctors and nurses you have to plan in the years to come? How many people are unemployed? What is the wages? All these things. This is what labor economics talk about. But it's much more important for the labor economists to know why certain things happen. Why is younger people more unemployed than other people? Why do the nurses don't get so much wages? Why? We know the numbers, we can get it. But in labor economics, we always ask the question, why? It's not just knowing that, okay, Malawi's unemployment rate is 6.9. What does that mean, the 6.9? That's what labor economics is all about. That's what we do. We try to understand and propose solutions, right? So there are three big actors in the labor economics, right? The workers, I mentioned, who want the sky, who want the best working conditions. As I said, you want to have 50 days of leave, you want to work 5 days a week, not 8 days a week, 5 hours per day, not 8 hours per day, right? So you put your demand, and that demand is then discussed with the firms or the private sector that who employs you, or the government if they employ you, right? So those are the dynamics that you have to look into. So workers want the maximum, and your employers want to maximize the profit. So you have to come to a conclusion in between. So the firms want to maximize the profit, and that's why the government comes there, your government comes there to put rules and regulations so that the labor market operates fairly. And in fact, that fairly means, I took this picture. I was going to Salima 3 days ago, saw that street vendor, right? So, for example, in Malawi, 80% of the people who are working are in the informal sector. When we talk about informal sector, do they have a wage? They don't. They get whatever they can sell or how they thrive. Is their wages guaranteed? No. What happens if they become sick? They don't have any money. So most of the Malawi, and in fact in most African countries, it's about 80 to 90% of the people who are working in the informal sector. And that's what ILO is trying to also do. How can you help move these people who are in the informal sector to the formal sector? Right? That's one of the things. For many of them, if you don't work, you don't have any meal, right? So the health is a labor market input, right? If you have good health, you are more productive, right? So that's where the interface between the health economics and the labor economics comes in. And then I'll come back to that later on. So health is also a labor market outcome. For example, if you come and work in poor conditions, your surrounding is polluted. If the nurses go to the health centers which is not safe, which is not nice to work, nurses become sick. Therefore, they are not able to work. The productivity and the services will be low. So that's where the interface between health economics and labor economics comes into play. Right. I'm giving some examples. For example, I mean, the driver that brought me here, his daughter is a nurse. He was telling me she's working on shifts, and he was saying that she always complains that they don't have enough materials in the stock, and she cries at times. He was telling me the story. So I think labor economics is also about how you plan your workforce. Today, in fact, today is the just a footnote. Today is the Dominic and lucky for you this question. Today is a special day internationally. Yeah, 10th October. When is 10th October? Today is the World Health Mental Day. Oh, yeah. So, the mental well-being is extremely important in health economics, but also in labor economics. If you are not well mentally, you won't be able to work nicely, right? So, today, I mean, just looking at the burnout cost, like people are working extra hours and they're so tired and they're not able to work. Yeah, today we are celebrating, thinking about that mental world day today, right? So I was talking about this, again, the pictures are from me. I was in Selima, I was stopping on the streets and talking to kids, informal market vendors, right? They have no sick leave, no maternity protection, no social protection. What to do about that, right? So that's a big issue. The vulnerabilities, not only economic, but it's social, generational vulnerabilities that has created because you are working in the informal sector. So why labor economics belongs to the health economics? That's why I was coming to, right? Labor economics helps us understand why skills are not used, what kind of skills do we need, why women face gender wage gap we're talking about, and why does nurses don't get enough pay? Why don't teachers get enough pay? Those are the questions we ask. And you as economists, health economists should be able to answer those questions. And those who are working on these particular issues, those are the things that we have to scratch the surface. So here's what I was doing yesterday with the RDAC meeting. So what I do is what we call evidence-based policy making. So we plug in research and data to have more informed policies, right? What we do is, for example, the policy challenge, what works, how can we know what works, right? That's the research that shows that. For example, I was talking to your PS, for example, she said we have a fantastic youth unemployment program, and it's not working. We have done our research to find out that the youth unemployment program is not working. There's a story I want to tell here. At times, your governments, not only in Malawi but in many countries, create policies which doesn't lead to the intention. Like about 100 years ago, when British was ruling India, in the capital New Delhi, there were a lot of snakes, cobras. So the British got tired of them, the cobras, and said, okay, whoever brings us a dead cobra, you'll be rewarded, right? So I'm sure you know these stories. Just to mention what a bad policy can do. So the Indians who were living there started bringing their cobras, and the British would pay them. Here's your money as a reward. So up to the point where the policies was working quite well, and then the Indians realized that in order to get the reward, well, we have to take a dead snake. So they started breeding snakes. So they breed the snakes, they took it, and they got their reward. Right? Then the British realized, in fact, there's a problem here. So they stopped the thing. Said, no, we can't do that. So what did the Indians do who were breeding the snakes? The snakes became useless for them, so they released it. So all the snakes were released. So in fact, the problem became even worse than it was initial, right? A bad policy. In other words, there's always a human factor that you have to consider. Incentives we talk about. So when we say about bad policies or policy failures, this term has been used as the Cobra effect. Cobra effect is a bad policy. So when I hear policymakers talk about we have a fantastic policy of youth unemployment and your youth is still like massively unemployed, I don't know what policy is that, right? Anyway, in our evidence-based policy making, what we do is we give them the leadership tools, right? Research and data and how you make policies. And I'll go through that, what we do exactly, right? So normally we train these senior policymakers. We have a 6-step model. First one is basically we try to teach them how to define a problem. You know, you guys are researchers, right? You have your research questions. You know, what factors explain, etc., etc., how, you know, why are nurses not paid enough? Here we're talking about policy. Policy question is, for example, if you say you understood why the wages of the nurses is low, so the policy question would be, how can we address low pay in the nursing sector? So how can you address? First step, that we spend about half day about defining the policy question. Then we take them into who are the stakeholders, how are policies made. In Malawi, for example, there are donor interest, you know, other countries got involved, media, cabinet, parliament, research institutions, HEPU gets involved, you know, all the stakeholders. And then finding those evidence, where will you get the data, the research, the best practice? Second module. The third one is that once you have got your evidence, what we call, we try to appraise it. Which one is good, which one is not good, right? And we show them some of the criteria for understanding the research quality, the sample size, the credibility of the authors who the institutions will look into. The fourth component is then you bringing together everything together and writing into a neat policy brief. We teach them how to write policy brief, 4-page of policy brief, so that they can take it to the minister and say this is what we want to do to solve, for example, the low-paid sector in the nursing sector. And then we teach them how to communicate to the ministers. Communication, that's where I think somebody will ask me a question, when do you know your research is useful, it's been used? The big problem with researchers is they are not communicating to the policymakers. So we teach them how to communicate. And there's a model that we use called success. Success is S, you have to be always simple. U, something unexpected, so that people pay attention. Credible, we were talking about being credible. Concrete, and whatever you're talking about, your message should have some emotions. And S means storytelling, so success, remember that stories. So we teach them those things, and then exactly how they are proposing the recommendation, what policy should be changed. So these are the 6 things that I teach to policymakers. And as I said, I have trained over 6,000 people worldwide on these kind of policies in about 150 countries. Malawi was one of them, right? Yeah, so I can give you an example. For example, I was here yesterday in the meeting room. One of the labor officials from the labor, he mentioned this is the first time I have seen how to turn our reports into actual tools to influence. One of the labor commissioners mentioned to me. Another one mentioned you don't need perfect data to make better decisions. You need good judgment supported by honest evidence. That's what they tell us. Right? This is what we do in terms of, these are the summaries of our 6 modules that we do. The first is understanding what decent work is, what is labor economics, and all those things we explain to them. These slides will be given to you if those you are interested. The second one is about the policy making process. Remember, what is evidence, what is policy, the types of evidence, research data, best practice. Where to search for evidence, we will show them the databases, ILO's databases, World Bank's databases, and we have subscription to most of the online journals, so we share it with them. How to appraise the evidence in terms of source and credibility, the quality of the evidence they get, the relevance, and whether it's objective or subjective. 4 things we look into. The 5th is on synthesizing and how to write a policy brief. This is for more policy-related work. And the 6th is about communicating evidence. This is what we do. Right? Any questions so far? Or you are too busy eating your food?
I have a question.
Yeah. Please.
Okay. I think in one of the slides you said Malawi is 80% of Malawi's population is working population is in the informal sectors, agriculture and other sectors. So factoring in that Malawi is mainly dominant on agriculture, and you said the idea is to move people from the informal to formal sectors, but also with the unemployment rates right now. Maybe what strategies from your research have proven to be effective for this, but also where do you find the balance, considering that there's high unemployment already?
If we can solve Malawi's problem, and I will get a Nobel Peace Prize, Nobel Prize in Economics, it's a complex matter, right? There's a lot of signals to send. I mean, no country has ever solved youth unemployment. We can help mitigate those things, right? But not to solve the problem. First starts with having good evidence. That's what we start with, having the good evidence. Why is that? Why don't people want to become formalize themselves? What's the reason?
The question was again.
Why do people don't want to formalize themselves? Like, why do people want to go and work in the agriculture sector?
One of the factors is education. Very complete education. You have low like education competition rates in Malawi, so they're forced into farming.
They're forced to.
Yeah,
Exactly. Right. So what should the government do?
There's also a cost to formalize, formalize.
To formalize, there's a cost, exactly. That's what I was coming to. But you said, okay, let's hold on to the education component, right? So you're telling me, okay, it's lack of education. People are not. So what should the government do?
It has to come up with policies to ensure that they create employment.
No, but before that, let's find the root cause there.
Invest in education.
Invest in better education.
Yeah, but that was the other point of my question, that even like the educated people are now struggling and also getting education.
Okay, why do they do that?
Because there's no good jobs for them, so they have to create some income for themselves by.
So why is there's no jobs? That's where the research comes in, huh? That's where the research comes in. Why there's no jobs? And I think we know those answers. You are not the first one to ask those questions. We know why there's no jobs. Yes, please. Yeah.
I think it's just a matter of a mindset, kind of, because most of us, when we attain that level of education, we want to be employed. So that mindset contributes. And also, it's a matter of if you want to be do your own thing, where you get the capital. Because other countries, they support, you maybe China, can support you, maybe they cannot employ full time, but maybe they can give you something for a start, a 5-year contract, and then they get you. So that one comes like a capital for you to invest in your own things, which does not happen here.
Absolutely, investment is a big issue. Why isn't the investment? Because either the government is taxing too much, there's too much of corruption. We know the problems, right? But it's not been addressed. You can talk to the government, of course, they'll say sure, but nothing will happen, right? Sorry, yeah. I'll come back to you. Yes.
I had a question on, you say there was evidence that some of the youth programs have not worked.
Yeah.
I had a similar evidence in terms of health where some programs, initially they were well implemented, but then later on the sustainability of the program. One of the problems I saw was that sometimes the partners that come in already have a vision of what they want to implement. So they will impose those priorities on the people, and you will do it while they're funding, but after they stop funding, you will not continue it. How do we get to a point where we can marry what we want on the ground and enable the people coming in with the funding to direct them in the right direction to enable sustainability?
These kind of questions are always asked by the permanent secretaries also. So what we tell them, and I mentioned right at the beginning, that any policy you make is politics. So that politics is either domestic politics or international geopolitics, whatever it is, right? So policy making is politics, right? So understand this, that's number one. Number two is that there will be many actors involved in policy making, whether in health, in education, many actors, right? So each with their own interest, right? So World Bank has their own interest, UK government has its own interest, China, somebody was talking about China, has their own interest. It's normal, right? Religious bodies, NGOs will have their own interest, right? The donors have their own interest. Media, parliament, cabinet, everybody has their own interest, right? Now, if you have evidence, that's where I come in with evidence. You tell them, here's the evidence and this is what we want to achieve, right? Although you know it's all political, everybody has their interest, when you bring evidence to the table, your equation becomes neatly presented. Although we know it's politics there also. Certain evidence, you say, I don't agree with that, right? You can discard that, right? But apart from evidence-based policy making we're talking about, there are other factors that determine policy making, which is values, type of government, right? Their ideologies, right? Right-wing, left-wing, whichever. Opinion-based policy making, not evidence, but opinion. It could be historical context. It could be donor. It could be geopolitics now with Russia, China, America, India. So those other factors will also determine policy making. The contingencies, like something has to be done right now, we have to do it. If there's evidence or not evidence, we have to do it anyway, right? Something. So that's contingency-based policy making. So there are many factors in policy making. Policy making is not straightforward, right? So when you design policies, there's the question of how who shares the information, who is in the authority, who finances them, who monitors them. There's all these complexities in policy making, and that's what we teach. and I think government people know those things, but I think we have to remind them many times, all these things about policy failures. You spend so much money and you get policy failures. And here was the question, what to do. We know the answers. We know the answers because research has been done. The governments are not doing it for whatever reason because it's politics. So you are the people who will change your countries. Demand for answers. I was in Nepal last month. I was doing a training in Nepal for Nepal. While I was there, do you know what happened in Nepal?
Yes, they overthrew the government.
They overthrew the government. I was in Nepal, I was blocked there for a week, in fact, because the airports were shut down. The Gen Zs, Gen Zs, right? They went to the streets, asked the government, there was too much corruption, nothing was happening, they called it the Nepo kids. Nepo kids, nepotism. All the politicians' kids were all given the contracts, their high-flying jobs and this and that. They said stop, so they burned the parliament, they burned the Supreme Court, they went to chase the politicians, took them out. The army was with them. So they changed the government, they overthrew the government. Gen Zs. I'm not saying you do that, I'll be kicked out from this country, but it's the people who ask answers from their government, that's all. There's research, but you know the answers, right? Yeah.
Just want to know, when did the Malawi join the International Republic?
Good one. You can check it now. I really don't know. There's a Japanese saying: if you think it's not right, don't do it. If you know it's not true, don't say it. And if you don't know, you shut up. So I really don't know. Just Google it, you'll find it. Maybe 1950s, somehow 60s. Who can do the Google search and tell me when Malawi joined ILO? Maybe in independence. Go to the last slide. Go to my last slide. Here? Okay. Just go to my last slide.
1965.
Huh?
1965.
65, that's right. Go to my last slide.
I have a question. I have a question. I want to ask about
Slide. No, just the slide. Put in the slide. Okay. Sorry.
Yeah, so you mentioned about honest evidence, and also you mentioned about values. Who sets those values? Is it something that is that there is a standard?
Yeah. Okay, the values is what is inherent in you. I mean, values and principles. I should not steal. The principle is a value. I should not kill somebody. That's a value. Right? Who said it's individual? It's you. Decide. I should not kill anybody. I should be kind to everybody. Those are values. I should help people. Right? That's my values. I should be human. I should promote justice. That's my value, my government's value, whatever. But if you have values, keep it. I should not lie. That's a value. I should be honest. That's your value. But these values also should be applied to the government, no? They should be doing the same thing. That's what the value I said. Or I believe in, that's another thing is ideologies comes in, right? I believe that the growth can only be led by the private sector, right? Businesses. It's not the government that creates jobs. So private sector, we need to really help the business community. How do you help business community? Well, decrease the taxes, provide them with better regulations, or lack of regulations. What, for example, Donald Trump is doing in America. He believes that. Right? Maybe I don't believe that. It's an ideology, right? So that's another component. Who sets the values? Well, it's you, personal. And then the government, for example, if you see the current government that is the president who is elected, look into his manifesto. What was his values and principles? In the first to second page, it's written. It's his values. And that's what he thinks that how Malawi should be taken forward in his manifesto. So that's where the values comes in. You say it. Nobody will dictate that this is my values and this is what you should do. It should not happen. Yeah? I think there was a question here somewhere first. I'll come back to you. Yeah.
Yeah, I had a question. You said you wanted to help many people from informal sector to formal sector. So my question is, how do you plan on doing that here in Malawi? You suppose many people did not go through formal education.
No, you mentioned about there's a cost to people moving from informal to formal. The cost is that they will have to pay taxes. They have to be better skilled. So they don't want to do that. Why should I be paying taxes when I can just survive life? No. So there are two components you have to do. One is putting more, the stick approach, like more compliance. If you are selling on the street, you are not allowed to sell on the street, right? Because it's a hazard and it's not hygienic conditions, so you should not be selling there. That's the rule, right? The government can put, right? But then they will start illegally doing things, right? But then the government can say, okay, if you formalize yourself, you don't have to pay taxes for 10 years. And we will provide you with health insurance for 5 years, free. That's called the incentive. Humans always react to incentives, right? And if the government provides incentive for those people, or also somebody selling food on the street, the government says, okay, come, I'll train you on how to have more clean stands, hygiene, right? Or we'll teach you a few more cooking lessons, right? People will be interested, and therefore they will formalize. Okay, so there's both the stick and the carrot approach. You have to make sure they comply, but also you have to bring them in, so that they don't feel it's just a burden on them. That's how we propose, right? Yeah.
One of the problems that we have is child labor.
Yeah.
And I know ILO is there to promote people not to play the children. But then you find that in Malawi, there's more people that are in the states, farms that are young ones who are supposed to be in school. And I'm sure people know that ILO is. And then there's nothing that's being done. So as ILO, what is something that we
Oh yeah, ILO has fantastic experience in reducing child labor. But child labor globally has been decreasing. And ILO has been working a lot with other countries to reduce child labor in the tobacco farming sector here, right? In Malawi. So some of the things that work well, in fact there are two issues of child labor generally. One is cultural, one is economic. Right? Cultural is in the sense that in the rural areas, people think that it's the human laborers, they should be working, right, to bring revenue, right? And the children the children are also social security, right? When parents are sick, they take care of them, right? So children have to work, they are labor force, right? So the cultural approach comes in. The economic is that, it's poverty. Most of the people are poor, therefore, as soon as the child can bring some money, it's a great addition to the household income. So so now we understood the problem. We know the problem, what leads to child labor. On the one hand, it's socio-economic, cultural, and socio-economic, right? So now the government has to attack those areas, right? So, try to decrease poverty, rural poverty, for example. The things that has worked very well is the conditional cash transfers. So, sending children to school, families receive, I don't know, $20 a month. You give $20 to the family, then if you have children, they should be in the school, not on the farms, right? And it has worked in many countries, right? So, conditional cash transfer. You get that cash transfer on the condition that you send your kids to the school, right? One is that, right? The other is education, educating families about children's rights. They have their right, more on the normative side, right? That also works. But then you have to induce them. That's what I'm saying. The cash really comes in, or you train the parents. It's also the parents who make decisions, right? So those are the elements that works. But then there is another element which I'm sure Malawi has, compulsory education. Like up to, I think, year 14, up to 14 years age, or 12 years age, education should be compulsory. Free education up to primary school, right? And all parents should send the kids to the school. And if the parents don't send, the parents are sanctioned. They are fined.
I don't think that's implemented.
No, there should be. In other countries, that's what has been happening.
I don't think in Malawi.
Well, you see the problem. In other countries, it has happened. If you don't send your kids to school and the local authorities know, that's why we take attendance. And then we'll go and ask the parents what's happening. Right? So both, again, the stick and the carrot approach. On the one hand, you have to give incentives for the parents to send, but also at the same time make sure that the parents are punished if they don't send the kids to the schools.
But now that you know that there's this problem and then there's this social stuff, what is ILO doing to help countries come up with social benefit?
That's exactly what I said. We have tried and tested, right? In many countries, in Congo, for example, Ivory Coast, in the cocoa sector, in Brazil. So these policies that have been tried and tested, we come here, for example, in Malawi, we say this is what is working. When I talk about evidence is research has shown this, data has shown this, and the best practices. Now, if you come to Malawi and talk and induce the government to do something about that, at the end of the day, if the government doesn't want to do it, we can't do much about that. I mean, there's a limit. If the country doesn't want to change, who are we? Guys from Geneva coming to tell Malawi what to do. Right? If Malawi government comes and says, please help us combat child labor in my country, we really need help. Right? We are happy to help. But if you don't need, we can't do that. You see the point? But many countries like India and, as I said, many in Zimbabwe, they come to us, not only to us, but they go to the donors. US at the time, now no more. UK, they're saying that we need to eliminate child labor. Can you give us $50 million? But they don't give directly. The UK doesn't give directly to the countries. They give it to us, and then we come and help the countries. The point is, if the country doesn't want to change, then we can't do that much about that. I mean, we have our own limits, so we are not the police of the world. Huh? Yeah.
So I have a question. In the case where you have the policies but are not being properly implemented, is there something that the ILO, International Labour Organization, does? For example, somebody talked about the policy where it's supposed to be compulsory education to primary school in Malawi, but we know that is already enforced. Is there anything that
Listen, education is the domain of UNESCO. They are the custodians of, there's a convention, and UNICEF has a child rights convention, right? So they deal with that. What ILO does is on the labor rights. I mentioned about 191 conventions ILO has. So what do we do if a country doesn't respect, for example, on minimum wage? They don't respect the minimum wage, right? And they have signed the convention. Well, there's a monitoring system where the countries, if they agree to that principle, they have to send reports to ILO how they are implementing that particular policy of minimum wage in law, what is the legislation, and in practice, so law and practice. So we look into that. So if we find that the country is not respecting that, we ask for a dialogue, right? We discuss with them, what's the problem, can we help you? Generally, they tell us, please come and help us, so we help them, right? If they really don't do anything and it keeps on going up and it escalates, we have a system where there are complaint mechanisms. Somebody can complain where my country is not respecting the international convention that they ratified, and therefore we then, ILO comes and has a mission to see what's the problem. And at the end, they are asked to come and present their case in front of the 187 member countries why they are not doing what they're supposed to do. It's like naming and shaming, and nobody wants to be there and telling why your country is not doing. So that deters a lot of countries. But the highest level of sanction we can impose a country is we create a commission of inquiry, and then the report that comes out from the commission, it becomes legally binding. So then the country has to follow that. If no, you can lose your voting rights. There are many things, and then ILO can also ask member countries to to look into sanctions, right? To look into the sanctions, economic sanctions in the countries. So we do have some leverage. Yeah. Any other questions before we have to end? Is that correct? Yeah. So the final message I want to mention is I'm here from the rural barefoot kid, right? I'm talking here when I was not supposed to be here, right? For me, I'm here is something has happened, and that's where I trust public policies. Public policies have transformed, right? So you, as I said, you nurses, researchers, health economists, you have a duty to do that. Please help your country. That's what I'm saying. Make sure the youth in Ngata Bay has a job, right? The nurse in Kasungu has a decent working condition and fairly remunerated, right? It's your job, right? For us, development is freedom. So try to develop your country. That's what the message is. As researchers, as Gen Zs, as nurses, as citizens, I want you to take the destiny of the country in your own hands. That's what I want to mention. But yes, thank you. I want to mention, this is my last slide, and there's a surprise, is this one. I have a cat. His name is Kitsune, and he has taught me many, many things, especially on the communication side. He teaches me how to communicate with people, because he can't talk, he meows, but whatever he wants, he gets it, somehow. I don't know whether you are cat lovers or dog lovers, right? But I'm a cat lover, we have a cat love. So in fact, the cat can really convince a human being. Really can convince a human being. How it gets up, how it will meow, and he is fearless. He will go jump from anywhere, but wherever he will jump, he will fall on his legs. Right? That's something, right? So me, stay human. I mean, I was talking about the cat, and even if things become political, we're talking about values. Have your values and principles. I really want Malawi to get developed, and we are here to help you if you want the help. And is my colleague Ken there or no? Because I wanted him to say a few words too.
The name again is
Ken Shawa.
He's on YouTube. He's on YouTube, so join on YouTube.
He can't speak?
Unless he joins something. They're not right through, but maybe.
Because I wanted him to talk.
I think he's able to hear you, just that he's.
So if you want to get in touch with me, my email is there. Ken Shower's email is here. He works with me. He's based in Bangkok. And I want you also, for the researchers, to know is that he has written many papers on health economics. And when you're done, let me. I'll go to the last slide. And these are the papers that he has written. If those of you are interested in understanding what Ken does, he's a fantastic economist with 2 PhDs, 3 masters. He's from Malawi, yeah? And just look into his latest papers. Maybe he's not available. Yeah. It was a pleasure talking to you. I hope it was useful and the lunch was good. Although I have not tried yet, I look forward to having that lunch. This chocolate is for you guys. I know the book is finished, and take away the pens, that whatever is left, it's all yours. Any other questions that you have?
Yes, there's a question on the side. Okay, let's take one, guys. Let us not take 3, 4, everyone to have a pen. Let us not be greedy.
That's a value. What's the question online?
So the question is, I dropped from your books from explanation and reply shows that you are a labor economist specialist. How would that expertise help modify and modify help, which typically is a health economic institution?
So that was the question. In fact, health economics and labor economics are very much linked. That's why we're talking about. It's microeconomics, by the way. Health economics is microeconomics, and labor economics is also micro. Now, when we talk about the workforce, we talk about people and good health shocks. There was a nice paper on that, I think, health shocks there. And labor economics are really linked together, both in the method, but also on the outcomes side. Yeah?
Then there is another comment from Ken Kawa, I think
Candice.
says that I cannot talk on this system. So I think Ken, if you can hear us, I think you share your emails to the participants. So in any case, they have a question for you, I think they will be able to help you. You can hear us, but
you can't talk, huh?
Yes. But
you don't have the Zoom connection?
We have you join the
Can you connect to the Zoom?
you can type.
Yeah, okay. Take his email. He's a fantastic Malawian economist, labor economist, health economist, so he can help you, guide you, okay? I think Dominic knows him well. Any other thing that you want to know about me, about ILO, about what I do, how we can help, how you can be part of our trainings? Yeah.
So as we are doing a research proposal and write a research project, so maybe we will be asking some questions when we have written our research program and research topics.
With pleasure.
We'll be asking you some questions.
Yes, sure.
Yeah, through your email.
Yeah, to my email, with pleasure, as I said. Send me your questions about your research proposals. I'll be happy to, if I can, if no, I'll refer it to somebody else. Yes.
So actually, for me, it has been a life changing, and we've gained a lot from your background, what you've done, and where you are now, which gives me a courage that I can do more in life, though maybe with so many struggles in life, but everyone has a chance to make it in life. And also, I would want to say that it's my ambition to work with international organizations, mainly these which volunteers to help people around the world. Of course, I have my small NGO, which I support the needed. So I feel like this is the way to go for policy making, because policies are the ones which change things. Yeah.
That's great. If I can help, let me know. If I can do it barefoot, I'm sure you can.
Yeah, actually, we've moved barefooted in rain.
I just want to know what's the academic path for becoming a policymaker?
Sorry, what?
What's the academic path for a mental student?
There's no academic path to a policymaker. It depends on your interest. Policymaker, it could be in the government, it could be in the private sector, you can be in the international or national organizations. You make policies, right? Policies are something that are done to change the people's life. There's no path that I can tell. It's your passion that takes you. It's what you want to become. Or at times, for me, I had never planned my life. Really, I never planned. I didn't even know where France was. I was in that remote. I didn't even know where France was, and I didn't even want to work with the United Nations. I had no plans. So the thing is, at times it just happened. You are in the right place at the right time. Or there's a lucky star who's keeping an eye on you. For me, I think it was a lucky star. My life changed. I was in Paris in 1996. Instead of going back home to Fiji, because my scholarship, they were paying me to go back. And every year they were paying. I said, why should I go back? I said, let me try to get some internship. So I had a friend who was he had some connections with UNESCO. So he tells me, why don't you do an internship at UNESCO? I said, okay, let me try. So I wrote a nice letter. I remember that still letter. I write to UNESCO, I had this mathematical background. I said I will be able to create a cultural indicator for you guys, cultural indicator, with my mathematical background. And the guys, when they saw it, he said, either he's lying or he's mad. So they called me, because we can't quantify culture. We can't, culture is something abstract. So they called me, and then I explained to them what actually I meant. I said, we can create indicators, X, Y, Z, and that when you're young, you think the world is yours, right? So I convinced them. He said, okay, you report to duty on Monday. On Monday I went. They said, okay, we want you to draft a few things. And I was good at researching, right? So I wrote a book for them, A Cultural Approach to Development. It was published. If you look into, just do Google search, A Cultural Approach to Development. That was my book, the first book I contributed to in UNESCO. And that's how I got a job. He said, after my 6 months internship, unpaid, no paid, they said, do you want a job? I said, why not? I said, okay, we are hiring young professionals. And you should be below 30, and I said, okay, here's my thing. So I went through the interview and everything. They offered me the job. And I went to Bangkok, and then, you see, I had never planned, and then I have never looked back.
Yeah, sure.
It's just a lucky star.
It's good.
Yeah.
And also hardworking and determination.
I'm sure that played, I'm an average student. Huh?
Yeah.
Anything else?
Your email address again, please.
Huh?
The email address.
Oh, email address. This one, eh? That's mine and that's Ken's, right? It's a pleasure talking to you. As I said, thank you very much for your patience, and happy to engage with you. Thank you very much.
Thanks so much. Hope so it's great, yeah? Yeah, sometimes, I think if they haven't taken anything, I just have been inspired.
Thank you, that's what I was thinking.
Inspired, so that I believe that all connected to a few things. We appreciate so much. We know we're on a busy schedule, and to sort yourself and motivate our team.
Yes, that's it.
If we organize another session, who's going to come? So thanks so much. Our assistant departments, without you, I think it would have been a few faces. And initially I thought it's just students, but then, it's their instructors, members from other departments, here. So I think it's been great.
Very good.
Maybe before we close the research support center.
Yeah, so just a second. Apologies, we started a bit late. This is seminar number 91. We've only done 2 in Longwe, so we are learning. I'm sure you guys are also learning. When I was trying to get people to come, maybe 80% were saying we don't know what this is all about. So for us, I think we are learning. We'll do better. And even the caterers will do better. I think the food wasn't enough, I know that. So, but then this is the first time they're doing it, so I think we may need to talk with them and see how best we can learn from this. But then what I'm trying to say now is, sometimes we are not able to do the seminars here any longer because we are not able to find researchers who can actually do the talks. Because we're supposed to have one each and every month. So which means we're supposed to have 12 in a year. For some months we are not able to do them because we can't find researchers. So it's not only researchers, but even students. If you've done some research and you think
is worthwhile to share and people who actually learn something from it, please get in touch with us. My email is rmadi@kuhes.ac.mw. R, then double M, ADI@kuhes.ac.mw. So you will be seeing us coming to Longwe because I think we want to really be doing 6 in Blantyre, 6 in Longwe. Because if you can do 91 and then only 2 in Longwe, then we are not doing that. So please knock on our doors. We've got space, talk to us and say, let's organize this and let's see what we can learn from each other. Thank you.
Thanks. Yeah, but also I say policymakers are young, so if you do it, seminars in Blantyre, you have to be a bit lucky to. Yeah, so I think you can coordinate with us as well from the Economics and Policy Unit. I think most we do these think tanks. We create connections with the MOH mostly, the departments. Yeah, so I think we can work around the topics together and then find the people.
Yeah.
And then you facilitate like the way we've done this case.
Yeah, we can even present online, it's okay.
Yeah. So no, thanks. Yes, thanks so much.
And Doc, please, you're welcome. Thanks a lot. This platform is open for you. Even if you're somewhere else, you have something to talk to us, just get in touch with us.
No, yeah, so we need any course that we think is related. A bit more talks. I think we can do online.
Online, we can do online.
From Geneva.
With pleasure. With pleasure. On some other topics if you want. This was more general. If you want specific, I can.
And send the presentation over to some people. Can I share?
Yeah, do it in PDF. Send it in PDF.
All right.
Convert it in PDF and send it.
That's fine. So I'll share with your emails. Yeah. And then I'll also add your emails on the mailing list, so you see the posters for 6 seminars being doing this.
Yeah, we will. Great, thank you.
Thanks so much. No, thank you.